We have done this before. Good morning, everybody. Dan Bates, President and CEO of Greater Hamilton Chamber of Commerce, and we are thrilled that you could join us this morning on Coffee and Conversations. We are continuing to have very interesting presenters and conversations about topics that matter to you. And this morning, we are really excited. He will be on in just a minute to have Erik Balster from, he is our Butler County Health Commissioner. And he's relatively new to our community, but he's been on the job a few months and already making great impact. I have not actually met Erik in person, but we are on a Zoom call together every Wednesday. And I've always been impressed by his intelligence and clarity and ease of speaking on some very tough topics. So I think you're in for a real treat. He's going to be talking about what the health department is doing, kind of priorities post-COVID and some other things. So with that being said, you know who I am. In just a minute, we're going to do self-introductions. We are on Zoom this morning, as you know, and if you're on Zoom, you can ask questions of the presenter. If you're on Facebook Live, you type those questions into Tiffany and she will repeat them to the presenter so he can answer them. So Laura, are you doing self-introductions then?
I can do that. Hi, everyone. I'm Laura Merrill with the Greater Hamilton Chamber. We will just go around, tell me who you are and what company you're with. Chris Cannell, we will start with you.
I'm Chris Cannell. I'm with the Hamilton City Schools.
John. No, you're on mute.
Muted, John.
I'm John Murray. I have two companies, Words Rock and LTC USA. Thank you.
Glad to have you with us today. Mike.
I'm Mike Getter with Brown Dawson Flick Funeral Home.
Good to see you, Mike. And Nicole.
Hi, I'm Nicole Thacker with Accuracy Net Language Services.
Good. Glad to have you with us. And Tiffany.
I am Tiffany Grubb with the Greater Hamilton Chamber.
All right, Erik, we will let you take it away.
All right. Well, good morning, everybody. Thanks again to the Chamber for having me on to give an overview of the pandemic, what the health department does, and kind of what we're going to see in the future, or at least what we're going to hope to see in the future and strive for to better the community as a whole. So that's it. I'll tell you guys a little bit about myself. So yeah, as Dan pointed out, I am the health commissioner for Butler County General Health District. I've been in this role since late November of last year, and previous to this, I've experienced as health commissioner for about 9 years, just north of you guys in Preble County. I've also worked for the Ohio Department of Health, Warren County's health department, and did some work with US EPA as well. So I like to think that I've seen, the different shades of public health infrastructure in the US, and try and see if we can get them all to work together as best as we can. So that said, I do have a little presentation that I'm going to pop up here on the screen that will hopefully kind of guide the conversation. And again, feel free to ask questions and things like that as I go through this. The first portion of what I want to talk about is really an attempt, at least, to condense the last 2 years into something that we can at least review and learn from, and then again, kind of where we're headed and some of the possibilities and some of the problems that have arisen as a result of our hyper focus on COVID over the last 2 years. So give me just a moment and I will share my screen. All right, so you all should be seeing my presentation. All right, I got a thumbs up. All right, so again, thank you everybody for having me here today to discuss the health department, public health, and all things COVID, which I know that topic is getting old, but I think it is worth looking at where we've been, where we're going, and again, where we hope to be in the future. So again, we'll start here. Let's see if I can get this to move. So real quick about the health department. So one of the interesting things that I think, unfortunately was overshadowed by back to school and, the rise of the Delta variant of COVID was our health department had been undergoing a multi-year process to become a nationally accredited health department through the Public Health Accreditation Board, and that's a national accreditation body, much like a hospital or many of our businesses throughout the community. That basically signifies that you are meeting certain standards and basically goals and metrics that show that you're an efficient and well-oiled machine in whatever your field is. And in this particular case, this says to us that we're meeting both qualitative and quantitative standards that show that we're addressing public health needs in our community. So that can be reassuring both to our community that we are doing our job. You're getting a good bang for your buck on any taxpayer money, but additionally that we are hopefully moving a metric in one of our various areas of concentration. Like I said, this is a multi-year process, and it's actually in Ohio, we are the only state to require it for all health departments. And this is a recent requirement, but we're proud to say here with the health district here in Butler County that we are accredited, and we wear that badge proudly, just to show that we do take this very seriously, and we try our best to meet everyone's needs in the community. So 2021, these are our annual numbers last year for all of our COVID numbers. So obviously, the pandemic started really in February and March of 2020, but last year was really the year of the vaccine. I think in December of 2020, that is when the Pfizer Moderna vaccines first became, known, but also FDA, EUA, emergency use authorization approved. So, we obviously at that point were seeing a big rise in cases due to a variety of reasons, including the winter season and just people being indoors. And I think that was kind of really the height of, well, at least what we thought was the height of the numbers at that point in time. So we had in 2021 as a whole, we had 38,927 cases in Butler County, ODH verified deaths, 552, hospitalizations, 1,491. And the age range of these cases ranged from, those that have, just a couple months old all the way up to 103. Our median age was 37. And, I think the numbers that are particularly interesting in this is really the prevalence. So, when you think of Butler County's population, we're right around 400,000 people according to the most recent census. So about 10.2% of the Butler County population, was a case of this particular illness. And, some 10% of our population got COVID that we know of, that, through a test, through a physician or provider that was able to report it. So, most illnesses, we're not seeing at that high level. So it certainly did impact a ton of people. And this is just a graphical representation of really where the case trends went. So, I think, we started giving vaccines obviously in January or late December, early January, and, corresponding with those vaccines. And, we obviously started with targeted groups, the immunocompromised and those, those older individuals in the county that, are more susceptible to higher morbidity and mortality. And, we started getting them vaccinated, and we started seeing a decline in cases, deaths, and hospitalizations, which was great. And then, you see all the way, I think by about May or June of last year, I think most of us were kind of feeling pretty good, like this was all going to be behind us. And, we were going to be well on our way. And, up until really, I guess 2 days started with football practice, we were on that trend, but then, we started seeing a slight uptick. And then, once we get into August and September, October, we hit that Delta wave that, really, I wouldn't say it took us by surprise, but certainly, brought the realization that this wasn't quite done yet. And then, as you look at towards the end of the year where we saw really the highest number of cases we've seen, that's the Omicron wave. And, that proceeded all the way through up to current day. But as you'll see, I believe on the upcoming slides, the Omicron wave also, as quickly as it rose, it has quickly fallen as well, which is part of just, how, this virus is potentially going to, move on or adapt and be more of an endemic illness. So, so our response, I think, it's important to highlight, we just highlight what the virus did, but here's what we did as a health department to help combat the virus and do our part in 2021. So we do, so these are our total vaccine numbers. I'm sorry, this is not that. I'll come back to that one. So that was just the total for the entire pandemic, but I'll come back to that in just a moment. So again, we were just talking about the Omicron wave and really its decline from late last year, around New Year's, all the way down to current day. So this is a adjusted slide to show really now that our numbers are so low, which is a great thing. We're able to show that the moving average of these cases go down. So now we are obviously right around that moderate transmission rate on as you get towards the right side of this graph. And so we, as quickly as Omicron popped up, it also subsided as quickly. And there's a variety of reasons for that. Obviously vaccination and things like that certainly help. Additionally, as what we saw with Omicron was that it was by far, a quicker spreader, more, it was easier to spread. And, in that same sense, it was also had a quicker, disease period with most individuals. So, and I think that's why we're hopefully seeing somewhat of a burnout, but, as we've seen before, there is a possibility that, we'll see other variants and things like that, but the variants seem to be evolving in this way that is more of a quick, run through the community and out, and also being somewhat less severe. Just real quick, hospitalizations. This is for 2021. So again, the hospitalizations, the numbers really followed the trends that we saw with overall cases. So we saw, early in 2021, hospitalizations up a little bit and stable. Then you really see it the Delta wave in late August, September, October goes down. You think we're out of the woods, and then the Omicron wave, we see the hospitalizations go up again. And then, at the very tail end of this, it's worth noting that we have seen hospitalizations drop off quite a bit as well. So, there's obviously those two are very much linked. Deaths are the same way. I think you probably heard in the news or, at some point that deaths are a lagging indicator. There's a variety of reasons why that is, but yeah, typically we don't notice the death trend until after the hospitalizations and the cases have changed significantly. So this again shows those numbers, and again they're about these trends. If we had a good trend line going through here, would be about 2 to 3 weeks post cases or hospitalizations. So I think throughout the pandemic, all the way back to 2020, we saw different levels of how prepared you should be. And there were I think there was a public health advisory system at one point here in Ohio. And then, it's CDC's had different metrics and everything. So I think the one thing we've learned about COVID is that, it constantly changes and the guidance has evolved as such. So here's what we have for now. So here's, where the three metrics that the CDC is following and ODH is following as well as our department here in Butler County. So we are currently in the low portion, which is where we want to be. And at this point, we're only recommending that people stay up to date on their vaccines, and then if you have symptoms, get tested. But if you're sick, I think ultimately the best message, and I think the one thing we learned from COVID is, if you're sick, you should probably stay home. And that's a lesson that whether it's COVID, the flu, or any other respiratory illness that you might pass to others, take a day or two, get better, and and then reevaluate then. Then there's medium and high risk. I think for most of the state of Ohio, and I think that's coming up here on another slide, is in the low risk category. And that's a great place to be, especially after 2 years of unpredictability and being relatively high transmission, with the exception of last summer. But this is obviously subject to change, as we learned with just about everything with COVID. But for the moment, we are in that low category. So yeah, as I mentioned, here's today's current numbers. So our community level transmission is low. Our positivity rate is 2.55%. And we have an incidence rate of just around 20 people per 100,000. So just to put that in context for everybody, if we go back to January, our positivity rate was around 25% or higher at times, and our incidence rate was above 1,000 per 100,000. So we've come quite a way since then. We're here in mid-March. It's springtime officially, and things are drastically different than they were in the middle of winter. So definitely on the right track here in Ohio and in Butler County. So I did mention earlier that, what was our response to the health department? What did we do? How did we, help people with this? So, 2020, we saw a lot of effort to getting people tested and providing a lot of information. And 2021, we, at least here, we kind of call it the year of the vaccine, because we had a vaccine finally available for this illness that, we expected at some point to come along. And the really, again, from I think right after Christmas is when we got our first shipment at most of the health departments, and then really up until now, actually we're still giving these vaccines out. We've made a pretty big impact in that, and this is just through the health department. In 2021, we gave 40,994 vaccines. We vaccinated individuals from 358 different cities from across the world, but primarily the US or Ohio, and then from 33 different states. So, you didn't have to be a Butler County resident necessarily to get a vaccine from us. I think what people will probably recall early on in 2021 is at the fairgrounds, we worked with a variety of partners in the community, including the EMA commissioners and so on, to make those drive-through clinics happen. And so there are a lot of cold winter days giving vaccines, but I think we did a pretty amazing job with the community and with the staff here. So just a quick review of how that all went. I think everyone remembers basically from January through March, there's always this like, well, what group is next? What age group is next? And I think, you can kind of, there's a good graph of that coming up, but really this shows where the majority of our vaccines went down here. So, we basically, for the 20 to 64-year-old age group are the ones that we gave the most vaccinations to. As a health department, but we, other than, other than that, here's the next slide. So, vaccine clinics today. So, I think by now a lot of people have either chosen to get vaccinated, or have gotten a booster, or are awaiting the 6 month to 5-year-old vaccine, or are waiting to kind of see where things go. One of the things we are trying to do as a community is trying to get at some of the underserved communities within Butler County. So, there's more rural, harder to get into Hamilton, or you may not have a pharmacy close by. So what we're trying to do is bring clinics to to local areas that may want them for COVID-19, and then we're even hoping in the future to try and just get early childhood immunizations available to people on site. So for now, we're asking you if you have an area or an interest with, it can be a business, it can be a municipality, a township, doesn't matter. If you give us a call, and I have Jenny McCoy, who is our director of emergency preparedness, I have her contact info up there. We're certainly willing to meet people where they are at on this, and just make that opportunity available. At this point, not only are we providing the vaccines, boosters, and so on, the local pharmacies, healthcare providers, and a variety of other healthcare related facilities are actually giving vaccines. So you don't have to come to the health department. We certainly do appreciate everyone that does, but really at the end of the day, we just want people to have the opportunity to get the vaccine if they so choose. So a quick update on vaccines. I mentioned the 6-month to 4-year-olds vaccine. And that was one of those things, I think in February, everyone was, and January for that matter, everyone was kind of thinking, oh, that's probably going to be what's next. Well, I think one of the things that got lost in the shuffle of news for a variety of worldwide topics, unfortunately, was what happened with this, what was the status of this. So in February, the FDA did their evaluation over the vaccine for children younger than 5. This was for Pfizer's vaccine, and really what they were looking at was not so much whether it was so much a safety issue, but what they're really looking at was whether they would need 2 or 3 doses to have any meaningful efficacy on the vaccine. And at this point, they're still looking at trials to figure that out. And from what we have been hearing, that it may be April or May when they have another a go at this in committee with the FDA to see if this is going to be something that they can put out to those that are 6 months to 4 or 5 years old. So the perhaps the most confusing thing right now is if you've been vaccinated or haven't been vaccinated, or if you've been vaccinated and you've had or you think you need a booster, what do you need? Where do you get it? Are you eligible for it? And it is complicated. So the slide I have up here now shows the different age groups, as well as the 3 different vaccines that we have, that are widely available in the U.S. and here in Butler County. So I'm not going to read through each of these, but I will say that depending on your age group and what your or other pre-existing conditions and things like that, there are different scenarios in which in timeframes in which a booster is recommended, or a 3rd dose, for those who may be immunocompromised and so on. So this is available on our website, as well as on the CDC's website and ODH's website. And I just want to point out that really with this, that there is some variation at this point until vaccines become fully approved for all age groups. But by and large, when in doubt, consult your physician or healthcare provider on that. So we just talked a bunch about COVID, and I think obviously pandemics and disease outbreaks are certainly one of the bigger things that the health department does. But I think what got lost in the shuffle, and what we really wanted to highlight, with our achievement of accreditation last year, had the Delta and Omicron surges not been as prolific, was not only were we accredited, but we do quite a bit here at the health department that many are unaware of, or may not know that it's exactly the health department doing it. So when you think of the health department, people probably think of a variety of different things, or maybe very limited things. But I think the one biggest thing that I thought of is that I thought about with health departments even before I ever worked at one. When I was working at a sandwich shop up in Dayton in high school, was food safety and health inspectors. So one of the big things we do is we license all facilities that sell and serve food within our jurisdiction here in Butler County. So, that's one of the things that we have inspectors out every day going through and it's not so much that we're out there policing any of these things, is that we're trying to help people ultimately make their businesses better and safer for the community. Some other really important things. So household sewage treatment systems. So, a lot of people are on, in Hamilton, for example, and in Middletown and Fairfield and Trenton and some of the more city and urban areas, you have, public sewage, but, a lot of people are still on septic and wells. So that's something that we help regulate as well. The rabies surveillance is another one that people probably don't think about, but whenever there's a dog bite and it's reported through a hospital, we do follow up with that, ensure that the whatever animal that bit the individual is up to date on the rabies vaccine, and if not, we go through a quarantining phase. And one thing I would like to point out, we don't take anyone's dog or cat away from them. So that is something that people often get confused when they get a letter from us by. We're just trying to make sure that they're up to date on their rabies vaccines and things like that. But we're not in the business of taking dogs and cats away. We do inspect schools, campgrounds, nuisances, mosquitoes. Prior to COVID, we were all talking about Zika and trying to abate mosquito nuisances. And I do think that's something we're going to continue to do, obviously. And we were still doing it, but again, COVID kind of overshadowed a lot of those things. Plumbing is another one of the big topics that we do in public health that a lot of people don't necessarily associate with us. So there's one of the cool things about Butler County is we have a lot of new businesses going in all over the place, new housing developments, properties, all kinds of things. And every one of those, needs a plumbing permit and is inspected and reviewed by us to ensure safety. And that goes kind of with the whole food safety portion as well, like with all of our restaurants and things like that, goes hand in hand. Obviously nursing, so, vaccines and immunizations are one of the big things we've done throughout 2021 and into 2022. But, prior to COVID, back to school immunizations, all the required stuff you need for college or just to go to grade school and all that. So we offer that, and we offer that here at the clinic within our department. We have a Hep B program, tuberculosis clinic, which is actually a very important thing that a lot of people don't realize we do, but keeping TB from becoming something that we're talking about in the news or in groups like this, that's part of the reason we have that clinic. And then ultimately epidemiology. So, we've been tracking COVID all year, but or the last 2 years. But beyond that, there's other diseases we track that are reportable. Everything from STDs, HIV, to things like norovirus and GI bugs. Those are all things we monitor and respond to outbreaks on. Then we get into health promotion, maternal and child health. Those are all more of our health promotion and education sectors. And there's a lot of great programs we have in that. One of the more recent ones, which you might be seeing billboards or some advertising around, is the Whole Woman Project, which is really focused on women's health and getting women access and just awareness of some of the programs and things we can offer both as a community and as a health department. Emergency preparedness, that's another one. Planning for these pandemics and responding to them is a key fixture in public health and has been for decades. Really after 9/11, it became as robust as it is today. But I think it's a testament to the planning and things that went on well before this pandemic that we were able to at least respond to it in a very successful way. And then finally, birth and death certificates. So one thing that we do we had quite a few people in every day for his birth certificates. And, with the changing of the Ohio driver's license requirement and for the, I forget the name of the version of the driver's license you need to be able to fly. But, birth certificates have been, way more popular of a service we offer here at the health department as a result. And, we certainly welcome people to come in and get those as well as death certificates. And then finally, we do have administration that includes myself and several others in the department that, keep all the other programs up and running and moving and responding as such. So we do, there's quite a bit going on here during a pandemic and not during a pandemic. And certainly we're always welcome. We always welcome any inquiries and calls as far as or responses through email or the website for any of these concerns or any of these issues. So the future of things here with the health department. So, I'm going to touch a little bit on the pandemic here, but also just about public health in general in the county. So, I think what we've seen through the pandemic and through a lot of the other things that are going on, including, the opioid crisis, which never really went away through the course of the pandemic, is that we've, acquired additional staff to help address these needs, particularly in the harm reduction area, which does focus on the opioid epidemic and our drug and substance abuse areas. So, we're going to have to figure out a way to incorporate all these additional staff in a way that we're not, stacked on top of each other. So that's going to be one of our priorities, just at least internally here. But in addition to that, we're bringing the clinics back into the health department as well. I did mention that we're more than willing to go out in the public and provide vaccinations, especially during back to school time. I think that's going to be one of our main goals, is to meet people out in the community to do those things. However, we do want to offer vaccines here at our clinic here in downtown Hamilton as well. Data technology modernization. So, one of the, I did touch on environmental health and food inspections, but you can actually get all the food inspections that we do on our website. So, I certainly welcome anyone who has questions over, if you go to a restaurant and you're wondering, what happened, or, how did the health department, what did they find? You can find that kind of stuff on our website. But, we want to make things even more easier to access. And I think one of the things that, has always been kind of an afterthought, at least with a lot of governmental websites and things like that, is just, ease of access to the public and, and really just making things user friendly. You can find anything online, but, sometimes you have to look really hard to find it. And I think the goal with our website is to make all of those things very easy to access. And that's going to be at least one of my hopes to really push forward here in the coming year. So then post-COVID-19 issues, I think, I just touched on this, but the opioid crisis is still a crisis. And we've seen a rise in injectable drug use in general, but as associated with that, an increase in HIV positivity, an increase in overdose deaths, an increase in hospitalization and ER visits as a result of opioids. And I think, this is one of those things that, there's no single cause for this, but, 2 years of, complete disarray as far as, public health able to, really get a handle on it. But then additionally, just the isolation and social isolation that, many people went through over the last 2 years as a result of, changes in work, changes in just life in general, I think in some ways actually made this issue maybe a little worse, and, something that we're going to have to work extra hard on to address. And you're going to see a lot of attention on that from our department, from, hopefully from the community as a whole, as we move forward here in the coming months. There is the One Ohio, I think it's Purdue Pharma settlement that I think as a community here in Butler County and across the state, we're trying to figure out ways to utilize the funds from that to really address some of these problems moving forward. So that's another big area that we're going to be working on as a health department as well. So, finally, I think this is our mission every year, and certainly will be going forward, is improving all the lives of those who work and live and play in Butler County. I think there's a lot of great new things coming to the county, and there's a lot of great opportunity here for people to both work and visit, to shop and do all kinds of things. And we want to make sure that whether they're going to a restaurant or they're taking a shower or they're trying to get their driver's license, we have their areas covered. So we certainly want to be available to everybody and convenient, and we're going to work our best to make that so for everybody. Just a couple quick things to wrap up here, at least for my portion of the presentation. We just released our annual report, which is available on our website. Again, it really touches on, if you want to read a bunch of numbers and figure out or read about what we did over the last year, total number of various diseases, vaccines, all the COVID information, that's all in our annual report. And then finally, finding us online. I think, as we talked about data monetization just a moment ago, probably the best way to access us and find out a whole lot more about what we are doing as a department and, different public health news and information. You can find us at health.bcohio.us. And again, you can get all that information I talked about, including health inspections, forms, things to get, if you're building a house or starting a restaurant business or anything like that. This will at least get you started, but we certainly welcome you to call us, email us, message us on whatever social media you can find us on, and we'll do our best to get back to you and get someone that can provide you a good answer. So that said, that was my presentation, and yeah, I'm certainly open to any questions or any thoughts, and again, appreciate everyone's attention and time today.
I've got a question. Thanks, Eric, for this presentation. It was very informative. I've talked to a lot of my classmates. I'm 55, and it's that you hit that point where it's just normal, like, oh, you're forgetting people's names and this and that, and people joke about that. But I've talking to more and more individuals my age or that have had COVID, that they're saying, oh, I'm forgetting right in the middle of the sentence, I'm forgetting the word, that I'm looking for. And they've said that they've started to avoid situations because they're embarrassed that they're forgetting those, things. Are you seeing a lot of that?
So we have heard of some things like that. I think there's, a lot of people have said that, after infection or, after they've kind of gotten over the upper respiratory portions of it, there's like a brain fog. That's something that certainly, we have seen some of that. And, it's hard to say really what's causing that related to COVID, but yeah, it certainly has, I think, taken a toll on people in that regard. And yeah, it's one of those things that they're looking at, in addition to that, some people, I think this is one of the first things that they were talking about in 2020, loss of taste and smell, along with, the brain fogginess. The taste and smell issue can last with some people, we've heard, for almost 6 months. And, that might be a good diet tactic, perhaps, but yeah, that's not, that's certainly not something, that we want. And I know in many conversations that we've had with area physicians throughout the southwest portion of Ohio, in various hospital settings, they're seeing that and looking at different ways of treating not only the mental and brain fogginess as you mentioned, but some of these other factors, these long-term effects that we really don't know where they're going to go and how long they last. But certainly, yeah, it's something we're looking at, and there is attention being put on that, both from the local level on to the state and federal level as well.
Thank you.
Eric, I have a question. I think it's interesting. I mean, the reason we wanted you to come on here today, one of the reasons was, I don't think people realize all the things the health department is involved in, from, plumbing to sewage to, helping to fight the opioid crisis. So with that being said, you're the county. We also have a Hamilton City Health Department, and there's a Middletown City Health Department. So are all three departments working on the same things, or does sometimes things go up to a county level? I mean, how does that synergy work between the three different departments?
Sure, Danny, that's a great question. So yeah, Butler County's kind of unique, but also kind of fortunate as well in the fact that we have not only the county health department, which covers the entire county and all the jurisdictions that are not including cities, but Hamilton City and Middletown City both have health departments, and all three of our health departments can provide the basic essentials. So with respect to food inspections and things like that. So for example, Hamilton City Health Department will inspect and license those facilities within the Hamilton city limits for food and things like that. They offer vaccines, they offer birth and death certificates. Same with Middletown City's Health Department. And they all have other programs as far as communicable disease and things like that. From a county perspective, we cover all the other spaces that aren't directly covered by those cities. So from a jurisdiction standpoint, we certainly are separate on food licenses and things like that. But I do think we work together. Like through the pandemic, we've worked together to strategize, coordinate, and talk and work on disease surveillance. But again, when we're talking about some of these city health departments and our focus is that, for example, Middletown, Jackie, their health commissioner, is able to really be in touch with their community and be hyper focused on the problems that are directly affecting Middletown. Same with Hamilton and whatever issues they particularly have. That said, we do have a few more resources here at the county level that we're able to more broadly cover. So, the opioid crisis in particular, we have a whole section dedicated to harm reduction and looking at those things. And, we certainly want to help out all areas, within the county. And, one unfortunate aspect of some of the city health departments is that they may not have the staff to be able to cover all those things at one certain time. So we certainly want to work together with them, and we do to help, with various issues, including, the opioid crisis. But we typically try and work together as best as we can to mitigate any of these problems. But yeah, generally speaking, they're really territorial differences at best. But at the end of the day, we're all providing essentially the same services. But definitely we want to try and help each other out as best we can.
So I have another question back to COVID.
Sure.
And I would like to step away from COVID and never discuss it again, but it just seems to remain with us. With the incredibly high cases rising in China and Hong Kong, are health departments across the country talking about any kind of travel restriction requests or anything like that, from countries from where it's, because my understanding is in Hong Kong, it's the worst it's ever been. So how much of a threat does that become to us? And should we be advocating for something that keeps that threat from coming here?
Yeah, that's another good question. I think right now, we're seeing, if you turn on the news or look at you Google search, really any, like China in particular, you brought up China and Hong Kong, there are some reasons for their prolific rise in case numbers. I think, what we saw with Omicron and even Delta, but more so Omicron, is that, we could try and avoid widespread transmission of this disease for a while, but eventually it's going to catch up with you. And a lot of these parts of the world, China in particular, as well as some of these other European countries, which had really extreme measures, and they're letting up on those, are starting to see these prolific rises in numbers. And I think that's one part of it, is that they had, I think China, I believe, and I'm not positive on every aspect of this, but kind of a zero COVID policy, or with respect to transmission. I think they start to see a decrease in numbers over time, and let up a little, and they're seeing what we saw in the fall, I believe, of 2021. That said, development of other variants and things like that, I think there's a couple other ones that are offshoots of what we've seen with Omicron and Delta. And yeah, you're right, they are rising in number exponentially in some of these areas. And from a global travel standpoint, I think it's something that's one area where I think the US and the world kind of got caught off guard in 2020. And I don't think it would have prevented COVID from spreading worldwide like it did, but I do think there's certainly some I don't know, you can't really go back in time, but certainly I think things could have looked differently had certain travel barriers been put in place earlier on in the beginning stages of the pandemic. So it's certainly something that from that standpoint that needs to be considered. But again, I think what we're seeing right now is really just a lot of these other countries that didn't have the major spikes in numbers that the US had, just essentially getting what we have already had. And it's not to say that we don't need to be concerned or keeping an eye on it, but I do think ultimately they're dealing with a lot of the problems that we've already troubleshooted and been through. And the other, I think, thing that is worth noting is that we don't have as reliable numbers on vaccination and some of the other therapeutics that we currently have now from China, as far as their numbers and things like that. So I do think we do have some advantages and just better information that puts us just ahead of the curve on that part. But yeah, it'll be interesting to see where that goes in the future. I think if there is a variant that does pop up that is showing a higher mortality rate than what we've seen with Omicron or Delta, I certainly wouldn't discount or put it out of the realm of possibility that we might see travel restrictions and things like that. But at this point, it seems again to be more of it's just catching up to them in numbers where we've already been here in the US.
Well, I have another question. So if nobody else is going to ask questions, I will. With the opioid crisis, and I don't know if that's something that people think the health department being involved in as far as the battle with that. So could you kind of clarify, how you're fighting that? And is there a misperception, health department versus, law enforcement, all of that? I mean, you kind of just frame that for us?
Yeah, so one of the I think really cool things we do at the health department is surveillance. And typically we looked at you would associate us again looking at everything from GI bugs to STDs to the flu and things like that. And we're really fortunate to have a whole harm reduction team, including a harm reduction epidemiologist. So every day we're monitoring hospital admission rates for things like overdose admissions, deaths from overdoses, and really the trends that accompany them. And we can kind of see where there's spikes in the community, in areas of the community as well that that need to have attention addressed to them in that regard. So, you know, from a standpoint of surveillance, we do that. But then additionally, from an education standpoint and then service provider standpoint, we do quite a bit there as well. So, you know, we're in the midst of you know, working with our partners in the community, mental health board, and other local agencies and nonprofits to make certain services available. So I think directing people to care and treatment is one of the key things that we do, and try and get people in the right place. And then you know, also setting up things like syringe exchange programs, HIV testing, hepatitis testing, treatment, and so on. From a disease standpoint, we're heavily involved with. And then, you know, ultimately education, I think, is probably, you know, the biggest thing that we that we do and offer. And that's, you know, everything from speaking to, you know, groups like the chamber here, or, you know, getting on the community and getting involved with those particular areas that are, you know, really seeing the you know, the burden of this. And then, you know, I think finally, you know, we also, you know, hold a overdose fatality review, in which, and we do this every couple of weeks to review the cases that we have from our surveillance tactics, and try and figure out, how do we get ahead of this? How do we prevent this from happening in the future? So, you know, we're you know, this is a newer area for public health to venture into, but it is certainly a public health crisis that needs attention. But you know, we're doing everything from analyzing data to promoting good behaviors to offering services, and you know, really, it's not something that the health department can do on our own as well. I think that's probably the biggest message I could give to this group right now, is that, you know, we're not a end all be all or cure for any part of the opioid crisis. We're just a piece of in the community that can be utilized and helped, you know, that can help the community out and help drive things. But, you know, it takes everybody, you know, being actively involved, you know, members from the chamber, you know, elected officials, and just the general public caring and wanting to make a difference in this, that can really push over the edge. But, you know, again, we're just trying to be a team player in a bigger battle with respect to the opioid crisis.
Eric, I have a question about food service.
Sure.
While you were talking and looking at other things, I looked at some of the food service reports, the inspections, and some of them are pretty ugly, and some of them are okay, or most of them are okay. Most people are taken care of. Is there some way to, are these posted at the facilities? Are they on the doors? Do we have some rating system that makes us aware? Because I'm looking at this at one, and I'm not going to go into the name, but 7 critical and 8 non-critical. That really concerns me, that I walk into that place and not have a clue about, you know, the conditions that I can't see.
Sure. So there's a couple, and that's a great question too. There's a couple of different things I can go into with this. So, you know, I do know, you know, there are some counties throughout the country, you know, if you've ever done some traveling, you'll see like different placards or like, you know, grades, little stickers with grades from various health departments on you know, doors for various restaurants. I think last time I was in Columbus, I think Columbus or Franklin County up there utilizes a system like this. And you know, and I've seen everything from like a pass color to improving or something like that. But in any event, yeah, no. So in Butler County, we don't have any placarding system or grading system per se that we provide, you know, a food service establishment. So just very high level overview of what an inspection and what we do to give us some more context. So every food service establishment is inspected at least twice a year here in the county. And that inspection goes through everything, you know, from, as you mentioned, there's critical violations and then, you know, just typical violations. And, ultimately our goal is really to ensure that, people are safe, both working and visiting and eating at these places. And, one thing I'll point out, and having done these inspections in the past myself, some places do have bad days where they just get, they unfortunately have quite a few violations for a variety of issues. Even if at that time of inspection they have, as you point out on that one, up to 7 critical violations or something like that, if those aren't corrected, then further action is taken. So, I think it is worth pointing out that, so let's say, for example, whatever establishment that was decided that they were just not going to, address any of those issues. Well, that would be an instance where we would call them in for a hearing, and we could revoke their license. So typically those things are corrected over time in very quick order, especially if they're critical violations. They have to be corrected, within 24 hours in many cases. While there may be some with a lot of violations, they're not just let off the hook, because their license is certainly in play as far as something that, if they don't address those critical issues, their license would be in jeopardy. So hopefully that kind of answers your question as far as, how that's addressed. But yeah, I do agree. And I do like having some kind of sticker or decal or something that people come on their doors that can at least establish that the health department has visited the location. That's something I've seen in some of our neighboring health departments. And I think it does provide some reassurance to the public that, hey, we've been in here, and we were in. The ones I think I've seen in Warren County show that the month that they were in, how recently from the health department. So, I think that's something that we're certainly looking into. And one of the things that I wanted to bring to this area, just because I think, again, it brings awareness that, not only to the facility, but to the public, that there is a public health, review of the things going on. But yeah, as far as whether or not they hold the inspections on site, there may be a couple that do that here and there, but there's no requirement by law to hold any of the inspections in physical copies on site. But again, I can't appreciate that question. I do think, maybe, whether or not it's a grading scale, I don't know how we would do that necessarily, but I do think, something as simple as, last inspected on date, decals and stickers like that. I do think that does help, because it does remind, not only the public, but also the staff that, hey, we need to keep this on our radar and keep up whatever, they addressed at their previous inspection.
And my concern is not that you're not doing your job by any means. It really is. The one that I looked at once again, and really every other one for the most part is really good, is just the concept that I would never ever think, hey, I'm going to a restaurant, I'm going to check the Butler County health department to see what kind of health, inspection they had. I have to admit that I never do that. So that's why I'm saying it just made me wonder how we would know when we walk in what's going on.
Well, I will say, Eric, also, in New York City, they do have the grading system. And it made a big difference, being that we weren't even from there. We didn't know what the reputation of a lot of the restaurants were. But when you see that A, B, C, D on the door, D you're not going to go into. When that starts affecting their business, it gives them the incentive to clean their place up without even having an inspection. They're going to want to get the business back. We would go into A's and B's. We avoided C's, and we wouldn't even consider a D. It just gave us that opportunity, because like you say, the day that your inspector went in may have been a bad day. Well, what if your inspector hadn't gone in and a whole lot of people had gone in? Then it's a bad day for a whole lot of people. And I know there's a very well-known national franchise that's out there that on Facebook, people have been posting photographs left and right of cockroaches running around that place. And, it makes it look like maybe the health department isn't doing their job when, one post after another, people are posting pictures of cockroaches. And this is a national chain that you would think that they would even self-inspect to a certain degree. But so yeah, I think having some type of a badge or something in the window would definitely not just make it better for the people going in, but it would incentivize those restaurants to clean their act up.
Certainly, and and that's something that I think that was one of the things I always liked too. I brought up Columbus. Even back when I was an undergrad at Ohio State, forever ago, I remember seeing that stuff on facility doors and wondering, okay. And I even remember a restaurant that I was like, their color changed because they use the color system up there. I'm like, it makes me wonder a little bit. And even as a not quite as an intelligent 20-year-old at the time, I knew I probably should avoid this one. There's no amount of college partying that can eradicate every GI bug. So yeah, certainly I agree. And that's one of the things that it's worth mentioning too, that we do just when the pandemic started, we hired a new environmental health director, which oversees the food service inspection portion as well. So I know she wants to bring in a whole host of new ideas that, unfortunately, again, like with even the opioid crisis, we've unfortunately had to take our eye off some of our major priorities and other things that we've been working on prior. And but I do know that's something that she has discussed as well. So I wouldn't be shocked if in the near future, we do have some sort of system of awareness and notification to the public with respect to how food services have done, and at the very minimum that how recently they've been visited by the health department. But yeah, I mean, this is great feedback too, because I do think that you're right that it does reinforce positive behavior. I mean, no one wants people. I think everyone wants to be proud of their businesses and wants them to do well, certainly. But people, just like with diets and things, you can kind of fall off the wagon a little bit with eating well, and same thing goes with how clean you keep a place or your practices. So I think little reminders like that would certainly benefit, and there is I think a lot of value in that.
Being in food service in college, I worked for a guy at a restaurant who was a clean freak, and I learned a lot from him. But he told me, this is very unscientific, but it's something that I have done ever since I was 20 years old. He said, always check the restroom first. If the restroom is dirty, I guarantee you the kitchen is. So, so I find myself, if I go into a new restaurant, I always after I order, I make a dash to the bathroom that determines whether or not I stay or not. So and it kind of holds true. It's like, and if you go in some of these places and the restroom is so disgusting, you're like, I can't even think that I would eat here. So.
Yeah, we don't have, there's no, you're right. There's no like scientific metric I can draw to that, but just from my own experience, I would agree for the most part. And, we do check the restrooms too of these places that we inspect, and, ensure, our reason for that is really to ensure that there's adequate hand washing so that staff and people who visit can wash their hands. But yeah, if things are in disarray, that's another thing in which we'll address and write up as well. But yeah, just from my experience, just as a consumer in the world, I would agree there is a connection there.
I think that's it, right, Laura? We're over time.
Yeah.
Erik Balster, I want to thank you, our health commissioner for the county. I think this has been extremely informative and helpful. And, thank you for spending your time with us today. Do you want to make any announcements for the future, Laura, or?
So we'll be back on April 12th, another coffee and conversation. Our guest speaker that day is Charla Hale, the Director of Racial Justice at the YWCA. She's going to be discussing some more tangible ways businesses can diversify and go into some detail about the support the YWCA Hamilton offers in diversity. So should be an exciting topic. We'll be back on April 12th, 9 to 10 a.m. Erik, thank you so much for taking some time to share with us today. And we'll see you all back in a couple weeks.
And Laura,
Mhm.
before we sign off, if I can do a
Yes.
shameless plug here, since we're on Facebook Live and since this is open to the public.
Okay.
Today, from 4 to 7, over at Hamilton High School, they're having the Big Blue Showcase. Basically, it's a giant open house. Anybody's welcome to come. They want to find out more about the academic units or the athletic department. There's going to be the jazz band's going to perform and the show choir. There's also going to be over 30 community resources that will show what's available to not only the students, but the public. So love to have everybody come on out and see us.
That sounds great. Yeah, I wasn't aware of that going on today. So yeah, that's a good showcase over there at the high school. So 4 to 7, visit Hamilton High. What's their address on Eaton Avenue?
1165.
1165 Eaton Avenue, Hamilton High School. All right. Thank you, Chris. All
Thank
right.
you.
Well, we'll see everybody in a couple weeks then.
Thank you, everyone.
Bye.